All right, tonight we're catching up with the Solidarity Fund. Remember, the Solidarity Fund was established in March to respond to the COVID-19 crisis in South Africa. Government put forward some seed funding and then several big donors came forward. The Solidarity Fund is responsible for those donated funds by ordinary South Africans as well, and it works closely with government and business, but is independent of both. Well, this week, the Solidarity Fund delivered the first batch of ventilators to several hospitals in South Africa. To discuss tonight, we're joined by the chair of the Solidarity Fund, Gloria Serobe. Ms. Serobe, thank you for being with us. Tell us about the ventilators that were delivered this week. Was this a big moment for the fund?
It was a big moment. Thank you, Francis. The issue here is that because the South African government responded quite quickly to the pandemic, it quickly saw where the gaps are. And one of those gaps was that the big use of the ventilators did not match off what we have in the country, mainly because all of them 100% were 100% imported. Now, for a country with the well-known top scientists in the world, not to be able to deliver and produce them locally was quite odd. And so in May, June, already we had that discussion with the Department of Trade and Industry, and where they had formed a national ventilator project to put together a group of scientists who can actually look at the local production of what is this necessary equipment as in ventilators. And that produced a consortium led by CSIR, which is a government entity, where there's a concentration of the top scientists in the country, to actually produce them. And as a fund, we were quite eager to fund first the prototype so that it is well understood that it can work, and then they got their licenses from SAFRA, they get their approval from NDOH, they get their trial tests from Charlotte Maxeke. And 2 months later, we have now delivered our first 1,000 of those ventilators, and they have been spread through like 62 hospitals in the country. The second 2,000 is coming now. The plan is to produce 20,000 ventilators for the whole country. And we're quite excited about it because it's a combination of just local production by our own scientists and in our own state entity, and private sector comes in and backs that to happen.
Yeah. That is exciting. And you are saying as the Solidarity Fund that these were actually delivered a little earlier. But please explain, because there were reports a few days ago, the DA saying, where are the ventilators? Not much use for the Western Cape now. Weren't there plans even earlier? Why not right from the start saying we need local ventilators? Why only in June, July, I think you said?
As I say, COVID comes and exposes the fact that, yes, we do have ventilators in the country. They are all imported. They were enough for pre-COVID time. They were not enough for during the COVID. We had a shortage. And as we import and we sit in these countries, we are competing with the rest of the countries to get our own supplies. And so they're thinking about producing them locally, and it could be done. And that was quite something that excited us. Now that it is done, the question is always going to be, if COVID ends, do you still need the ventilators? Ventilators were used before COVID, during COVID, and the ventilators are going to be used after COVID because it is dealing with a particular product, a particular problem of health. And that health issue is not linked only to COVID. It is linked to people needing oxygen, breathing problems, and just so many of those illnesses that actually causes that. And so that is our excitement that for a change, we are producing for ourselves.
Yeah. So you've anticipated my next question. I mean, we were expecting the surge in South Africa. We were expecting hospitals to be overrun and people not having access to ventilators, doctors having to choose who lives and dies. But it seems like the peak has already come and gone in many provinces, and it's not as bad as we expected. So 20,000 ventilators, you're saying those are still necessary?
20,000 ventilators, 60 million people, a population of 60 million people, and ventilators being used for any other illnesses not related to COVID, because it's not only during COVID that people need ventilators. It is a necessary, just the COVID exposed the fact that all the ventilators we had in the country were imported and there was no need for that. We have all the combinations of the top scientists, the top brains, and funding them and to make it work. And all within 2 months is what was exciting for us. So yes, you will need them post-COVID and during.
Now that South Africa seems to be on a better path, however, overall, what does that mean for the Solidarity Fund? And I think this is a great opportunity to talk about the 3 billion rand raised for people who donated funds. Where has it gone? And there's still money in the bank. What do you see the Solidarity Fund spending on in future?
Okay, the bulk of the money went to what we call the health response, because the hospital beds, the high care, the ventilators, the testing, and all of that, we funded about almost 70 to 80% of the funding. Balance of the funding went to the humanitarian efforts, gender-based violence, shortage of food, and then the other piece of money went to the campaigning for good messaging and so on. If you ask me today what is going to be our emphasis going forward, I think the behavioral change is a big point of emphasis. People are going back to work. Things are opened. We still have to emphasize this thing of behavior, that COVID is not gone. COVID is just waiting for any victim who's just going to fetch it and take it to his or her grandmother at home, simply because they are 20-something years old, no symptoms showing. So I think our major effort is going to go towards the behavioral change to help with the message that COVID is not gone. The fact that we're slowly opening things, work, leisure, travel, and so on, does not mean that we should not still concentrate on behaving the way that we have been asked in terms of social distance, the masks, and as much as possible stay at home, how we behave around funerals and all of that. It is going to be the major point of emphasis for the fund.
But Serobe, finally, before we let you go, this has been an incredible experiment, the Solidarity Fund. You and other business people are working for free, working with government, with business, trying to rally around. But there were reports earlier about a lack of transparency around where the money was going, on which suppliers, business for South Africa. There have been mistakes made, some 2 million masks, I understand, being reported on that weren't of the exact quality required. Just how would you rate how the Solidarity Fund has performed thus far?
Sure. Given a crisis and given the kind of space we're in, the Solidarity Fund, first I must actually emphasize on this and thank the people who actually gave of themselves to actually make it work. There's over 80 people working pro bono. That's quite massive. And also the help from the Pricewaterhouse, the Edward Nathans, to make sure that our governance frameworks and all that kind of thing are in place. Absolutely wonderful. The reason we could even find faulty material and send it back was because the regime is very strict in the Solidarity Fund, as much as how young we are, 4 months, 5 months. It could be detected and we could send them back. And let me just emphasize that as soon as SABC did not find them a good quality, They were never taken to the market. They went back, and the replacements has got to be done. So it is what rating I'm giving. You're asking for a wrong person, because I probably want to give 100%, but to give an allowance for the fact that we can't be so perfect, I'll be happy with a 90%. People have thrown everything they could into this fund to make it work, and it has. It's amazing. I give it high rating because so much effort, and plus the fact that we were actually touched with the response of the South Africans to the fund in terms of individuals, companies, foundations, everybody, people in the shop rights, in the supermarkets, putting their last 10 rands or 2 rands to make it work. We could not fault on this in terms of governance and actually have money slipping through the systems, because these were hard-earned monies, and people were actually finding this to be the platform in which to respond to this crisis and make it work. And so at the back of that, we could not actually do anything less but give of ourselves. And I really would really give it high rating, but you are talking to the wrong person, because I have a self-interest on the rating.
All right, Ms. Serobe, well, thank you very much, and we will follow your efforts going forward. That was the chair of the Solidarity Fund, Gloria Serobe.
Thank you very much.
Now, very quickly.